My presentation on the intervention of Alzheimer's disease. Starting with the introduction, Alzheimer's was first clinically diagnosed over 100 years ago and is considered to be a syndrome or condition rather than disease due to the various causes that do lead to Alzheimer's. And although there is no certain way to cure Alzheimer's, there are several ways that early intervention can be used to delay the onset of further progression. And moving on to a definition of Alzheimer's, it is defined as a brain disorder that slowly deteriorates memory and thinking skills, also known as cognitive function, and eventually the ability to carry out simple everyday tasks, also known as physical function. Alzheimer's can be categorized as either neurodegenerative or non-neurodegenerative, which is irreversible and potentially reversible. Moving on to patient information, the patient's name is David Henderson. He's 63 years of age. He's male, 180 centimeters, and of 74 kilograms. I've calculated his BMI, which will be at 22.8 kilograms per meter squared, with his past employment being an outdoor recreation teacher. For physical activity, David liked to do bouldering 1 to 2 times per week and a weekly Sunday walk, which obviously is still quite active, but with his progression of his condition, it will need to be increased. With his LDL cholesterol being of 5.18 mmol, with medical history of ACL tears 6 years ago and shoulder dislocation 3 years ago. His family history shows familial hypercholesterolemia on his mother's side, and on his father's side, his grandmother had Alzheimer's disease, but it will be noted that Alzheimer's isn't usually inherited, but rather just an increased risk. Diagnosis of David is that he has early to middle stage Alzheimer's disease, with medication that he is taking is statin and antidepressants. His barriers to exercise are anxiety, depression, and lack of confidence. And the goals that he aims to reach from this physical intervention is retaining control of what he is able to do, being bouldering, pushing their physical and psychological limits, and remaining physically active to enhance his mood. Travelling has also been seen as a barrier as he stopped driving 6 months ago. Moving on to the role of exercise in prevention and management of Alzheimer's. As Alzheimer's progresses, the chance of anxiety and depression progress as well, decreasing self-confidence. Alzheimer's patients may feel they are losing control over their lives, hence why the implementation of a consistent routine into David's lifestyle is crucial. One of the aims of physical activity is to enhance the mood of the patient, including anxiety and depression. Stooge et al. 2018 analysed 49 studies comprising of 266,939 participants. Results of all 49 studies displayed a high correlation of 0.79 between increased exercise participation and increased levels of elderly mental health, including self-confidence, anxiety, and depression. Furthermore, physical activity can enhance the mood of an Alzheimer's patient by engaging in social settings to reduce the feeling of isolation, whilst also augmenting physical health, leading to an increased self-confidence and feeling of self-accomplishment. Falls are also a common serious problem for Alzheimer's patients, as they can lead to injuries and a decline in overall health. Regular exercise and physical activity have been found to improve balance, coordination, and strength, all of which can help reduce the risk of falls. Allen et al. 2009 reported that Alzheimer's patients are 8 to 10 times greater of risk of falls. Furthermore, physical activity can help reduce the risk of falls in individuals with Alzheimer's disease by improving balance, coordination, and strength, which are all aspects seen to decline as the disease progresses. The implementation of physical activity has been shown to have a positive impact on delaying cognitive decline in individuals with Alzheimer's disease. Regular exercise and physical activity have been found to improve blood flow to the brain, promote the growth of new brain cells, and increase the connections between brain cells. Furthermore, these changes can help to improve cognitive function and delay the progression of cognitive decline in individuals with Alzheimer's disease. As the condition progresses, the patient's memory and brain function begin to lessen, severely affecting everyday life and activities that can be undertaken. Furthermore, Egamon 2006 et al. Noted the significance of exercise amongst Alzheimer's patients in regard to a 6-month walking program, which was prescribed to investigate the inverse relationship between physical activity and cognitive decline. In conjunction with increasing age, the physical function of an Alzheimer's patient also withstands a noticeable decline in physical function. McCracken et al. 1993 discussed the functional abilities of an Alzheimer's patient, pre- and post-exercise intervention, as it was noted that post-exercise regular physical activity can significantly increase muscle strength and balance. Furthermore, Pitkala et al. 2013 reviewed 20 RCTs which all conclude consistent evidence that the use of regular physical activity exercise intervention enhances mobility with the possibility of improving physical function if administered over a long-term period. Similarly, Fang Yu 2011 summarised the outcomes of 5 studies as showing improvement in physical performance among older adults with Alzheimer's disease who participated in comprehensive exercise programs that had an aerobic exercise component. Exercise guidelines for Alzheimer's patients may differ from those for healthy individuals, as certain precautions must be taken to ensure safety and effectiveness. It is important to understand the specific exercise guidelines for Alzheimer's patients to help them maintain their physical and mental well-being while managing the symptoms of their condition. David lacks confidence due to past injuries, so reassurance is crucial and considerations must be taken for the following. Exercises must be made simplified, which are easy to understand, supervision to ensure safety, realistic about how much exercise can be done, hence why sessions have been broken up into morning and afternoon sessions, and the inclusion of music can be added to enhance willingness of the patient to comply and to perform the exercise and continue. Aerobic activity increases heart rate and breathing to build stamina, and over time the program will build up to be doing at least 150 minutes per week of moderate intensity activity. A crucial aspect of Alzheimer's patient-specific programs is the encouragement, regardless of if it is completed. The program will be 2 20-minute sessions per each aerobic day, one in the morning and one in the afternoon. Being Active with Alzheimer's Disease 2019 mentioned the benefit of a morning session, as this is when Alzheimer's patients have lower severity of symptoms. The type will be land aerobics. Examples of exercise include brisk walking, stationary cycling, and dancing. Brisk walking is great for low impact and can be altered to the fitness levels of the patient. Stationary cycling is great for the light intensity, low impact that can also be modified. And dancing is fun and enjoyable as an aerobic exercise that can be used to improve cardiovascular health, coordination, and balance. Resistance activity is used for daily activities like lifting laundry baskets or yard work. It is used to make it easier and safer. Getting stronger, particularly in the legs, stomach, and back, can help prevent falls. You can use hand weights, resistance bands, weight machines, or other body weight. Avoiding strain is crucial as it can raise blood pressure, which is often seen to be associated with hypercholesterolemia, as David does have this. David has previously injured his knee and shoulder, so administering exercises that are achievable and safe for these injury sites are crucial. The program involves 1 20-minute session per each resistance/balance flexibility training day as they are in conjunction. The type will be of body weight and or resistance. Cautions are for the upper and lower body exercises to be monitored due to past injuries. The examples will be seen on the screen of 3 times 10 sets of body weight forward lunges with a 30-second rest used to strengthen the lower body and past injury sites. Strengthening lower body to prevent falls as well. 3 sets of 10 at 40% 1 rep max overhead press with a 60-second rest. Also to strengthen the upper body and past injury sites of shoulder dislocation and used for everyday exercises of all reaching activities. There will be 3 sets of 40% 1RM kettlebell chest squats, 12 reps with 60 seconds rest, used to strengthen lower body and past injury sites at the knee, and also to prevent falls. Then there will be 3 sets of 10 resistance band side steps of 30 seconds rest. This strengthens the lower body and increases balance, also strengthening the lower body to prevent falls. Lastly, there will be 3 sets of 10 body weight wall push-ups at 30 seconds rest, used to strengthen the upper body and strengthening for everyday activities, e.g. gardening and carrying objects relating to the upper body strength for bouldering as well. Balance and flexibility improves the ability to resist forces that cause falls, whilst also strengthening physical function that tends to lessen as age increases in conjunction with the progression of Alzheimer's, causing frailty. Program will be as seen. There will be 1 20-minute session in conjunction with a resistance training day, which will be done in the morning. Stretching and Tai Chi, as well as yoga, will be the types of exercises. For the examples of exercise, we have 1 20-minute session of Tai Chi, which is a low impact that can improve balance, flexibility, and relaxation. Wu et al. 2013 discussed the importance of Tai Chi as it improves mind-body connection, which aids in the delay of cognitive decline, which is a symptom of Alzheimer's, and additionally discussed the breathing techniques associated with relaxation to aid mental health with anxiety and depression. Next, there will be 3 times 30 seconds stand on 1 foot with 30 seconds rest, promoting balance and stability of a single leg and aims at correcting any muscular imbalances, as well as reducing falls. There will be 3 sets of 12 stand with no hands from a sitting position with 30 seconds rest, promoting core and lower body strength, improving physical function. Maintains independence as it translates to daily tasks at home. This exercise will increase self-confidence and accomplishment. Lastly,
it will be a 120-minute session of yoga, helping to improve flexibility, balance, and relaxation. Brenner et al. Noted it is using common practice to reduce anxiety and depression, also conducting a study with what found 6 months of yoga resulting in significant improvements in immediate and delayed verbal memory, delayed visual memory, attention, and processing speed.
A weekly schedule is important for an Alzheimer's patient as it gives them a sense of purpose and fulfillment after completion of the task. As you can see, Monday will be aerobic exercise, 40 minutes, one session in the morning and one in the afternoon. Tuesday will be bouldering with a friend for 1 hour. Wednesday will be flexibility and balance exercise in the morning for 20 minutes and a resistance exercise 20 minutes in the afternoon. Thursday will be aerobic exercise. Friday will be bouldering with a friend for 1 hour. Saturday will be flexibility balance exercise in the morning for 20 minutes and resistance training for 20 minutes in the afternoon, as like Wednesday. And Sunday will be any type of exercise listed above for 30 minutes to 1 hour. Exercise routine adjustments are made to ensure the Alzheimer's patient adapts adequately without any issues that may cause physical or emotional stress. Firstly, time management techniques to establish a routine, anxiety and depression, sense of purpose, focused. Having a support system, whether that be friends or family, keeps motivation levels high. Thirdly, establishing a daily routine reduces confusion and anxiety. Fourthly, sit less and move around more. A fifth one will be keeping an exercise log to track progression, enhancing self-confidence and a feeling of self-worth as they complete exercises. Finally, in summary, the presentation had discussed goals which are used to increase mood, anxiety and depression, reduce risk of falls, increase confidence, delay cognitive decline and increase physical function. Daily physical activity participation is used to enforce lifestyle changes as well. Following the training program will be used to reap the benefits and succeed at the goals listed, and a checkup will be done monthly depending on the progression of the condition itself. Thank you.